Good evening, sir.
Good evening, sir.
Good evening, sir.
Good.
I joined the company. Anyway, let me know the number of participants. This session, what should be the total number of attendees? Can you give me, can you just update me about the class size? I want to know the class size.
Please, your voice is not clear.
I say, can you give me update or can you update me about the class size? The class size, the number of students who are supposed to be here with us. How many are the participants?
500.
500 plus. So where are the rest? The number of participants who have joined is 290. So where are the rest?
I can hardly hear, sir.
Those who haven't joined, tell them that we are more busy than them. Right? Anyway. Let's revisit our last conversation. I want 1 or 2, 3 students to give us a gist of information regarding, what transpired in our last meeting. So share with us some of the useful lessons you picked from our last meeting. Any angle you want to take it from, you are at liberty to do so. Feel free and get us your views. Are you with me? Are you with me?
Yes, sir.
Yes, sir.
Good. So who is setting the ball rolling? I want to hear your voices. What did you learn last time? I want to hear from you. If you don't tell me anything about our last meeting, I can't make any significant progress. So please, let's take note of that. Do you see the slides? Okay. Now let me go to Rose.
Sir, good afternoon.
Good evening.
Good afternoon, sir.
Good afternoon.
Hello. Yes.
Yeah, hello, Rose. I can hear you. Go ahead.
The previous lesson, you take us through about the informatics. You said, how do we know about, or how do we understand about informatics? And then we explain according to how we understood it. And informatics is the science, and I say the science and art of turning data into information. And then the science of processing the data for storage and retrieval. That's my view. And then informatics is the study of the application of the computer and the statistical techniques to the management of information. Thank you, sir.
Okay. I think That's a very good, feedback from you. Can we have 2 more other students to bring their views to bear with the conversation? Then we move on from here. Since I haven't gotten more than one person telling us something about our last meeting, those who share on the chat page, I prefer that let your voices be heard by all of us. Then when you get to our threshold or peak term, then we can share whatever message you have for us. So let's. Who is going again? Because I've been telling you that whatever we are going to do this semester, you are going to do most of the talking. You are working with these digital systems, computers, right? So we have to have interactive sessions, and most of them will be coming from you. So please, let's take note of that. What did we do? We have gotten to know about an aspect of informatics. So what again? Okay, now let me go to Elijah. Professor.
Professor. Please, I also want to.
Professor Elijah, that is what.
Please, I also want to.
Let's go.
All right, thank you. I want to briefly talk about the lesson informatics and some of the building blocks of the lesson informatics. And I wasn't actually here last week, but I've been able to get some information from some of my colleagues, and we say that nursing informatics is a specialty that basically integrates the nursing science, the computer science, and that of the information science. Now, during this integration, it helps us to identify and manage and communicate the data that we have gotten from the sources. And now, when we narrow it down to the building blocks, you realize that within the building blocks, we have the data, the information, and the knowledge, which we can basically describe them by saying that the data is actually the discrete entities that are described either objectively without interpretation. So within the data, we can go on by adding or specifying some of the things that are located within the data, the age, the patient's name, and the vital signs and others. Thank you, sir.
Good. That is coming from Professor, right? Professor. Always do extra mile. Anyway, good feedback. Now let's make progress from here. Just to confirm some of the things some of you have already mentioned. Last week we began looking at introduction to, the general course overview. We were introduced to the course content or the course structure, and then we also reviewed your expectations. That we said that your performance may also be anchored on how you received the thing that I will be sharing with you. And it is also guided by your expectations. So once you have high expectations, then nobody will have to tell you what you are supposed to do. Expectation goes with what? Responsibility. So even though that is what I said, but it is shared responsibility. And I believe, I remember I said that according to Chinese proverbs, teachers must open the door, but you must enter yourself. So about 70% will be dependent on you, and 30% may also be what you receive from us. So let's take note of that. So we also run through the introduction to nursing informatics. We look at what has really fueled the need to embrace technology, advance the course of healthcare delivery. We talk about different dynamics that are causing evolution in terms of where we find ourselves. And therefore, we cannot also be lagging behind. We need to also be immensely involved in these kind of innovations. And we can only do that once we have been able to look at the gaps and how we can bridge the gaps in advances in technology. Then we can also be there with those people who are making significant impacts. Then we also dwell on the fact that the people-based system are being the backbone of our healthcare delivery in terms of data management, among others. But we also notice some of the inherent challenges that may affect overall healthcare outcomes or decision-making. And therefore, in order to fill those gaps, there was the need for us to introduce digital systems or platforms that can be a more improved form over the traditional norm-based system, right? So that has been the introduction or what has really brought the interventions of digital innovations in healthcare delivery. Now, we got to know that we have informatics, but informatics is acting or applied in different disciplines or scenarios altogether. But our focus will be limited to activities emanating from general healthcare delivery, and for that specifically about nursing. So that is going to be our focus. Whatever we are going to do will be centered or geared towards activities nurses perform in line with their duties. Then the informatics, we said that it is the science and art of turning data into information. So the very pillars of nursing communication has to do with appreciating data, information, and then the knowledge that we also bring to bear. Then we also made a point that we can also put it this way: the application of information and communication technology in healthcare. So it is very important. But we said that the American Nurses Association, they came up with a clear definition of what should represent nursing informatics. Even though there have been different schools of thought, pioneering roles played by certain authors who established the field of informatics. But in terms of legitimizing or defining the scope of nursing informatics, it was the American Nursing Association. They adapted some of the concepts from those key authors or key actors, and then they used that to expand the scope of healthcare delivery or nursing generally. Right, that is where we ended our conversation. Now, we said that fundamentally, what you are going to do should hinge on the foundational knowledge that you bring to bear as nurses. Then we look at how we can optimize acquisition of technology or computers to support healthcare delivery. And then again, since we are also looking at data, so data management is very important. And for that matter, we are going to scrutinize what we mean by information science. So it is also one of the pillars we look at. Okay, then aside the one proposed by the American Nurses Association, we also look at the one proposed by American Medical Informatics Association. They were of the view that the application of information and communication technology in healthcare should rather affect the lives of our patients positively or provide overall healthcare outcomes. So whatever technology that you introduce, it shouldn't cause any injury or any harm to any patient, but it should affect families, communities globally. That is the picture by American Medical Informatics Association. These are considered as the most standardized or standard definition guiding nursing informatics. Then we said that nursing informatics support consumers, patients, nurses, and healthcare providers in decision making across all rules and settings. When we say that it affects nurses in all rules or diverse rules where nurses may work, we can look at how technology affects nursing education. A typical example is the conversation we are having. That is a virtual conversation. That is a typical case of how technology is also shaping or changing the face of nursing education. Secondly, we can also look at how technology is also impacting research. Research is very important. If you want to get evidence-based research, then we cannot discount or downplay the importance of informatics or technology generally. We can also look at how technology affects nursing administration. Those people who are the helms of affairs, they also require advanced forms of technology to transform or bring innovations to bear among their care providers or their clients. So that is also another aspect that we can also look at how technology also affects nursing clinical practice. And for that matter, the conversation we are going to have borders on activities nurses perform and how technologies may serve as well drivers to impact nurses in their diverse roles or in their roles. So all the conversation is going to be about how technology is shaping nursing clinical practice. Please, are you getting the feedback?
Yes.
Yeah, if I'm going very fast, then you let me know. You also have any question to ask, even though I'll dedicate some time for you to answer questions. But if you also have to ask, I'll also pause and take your concern. Now, what you are seeing here is a typical view of how technology has been transformed from the non-paper-based system to a more robust system that is inclusive or that includes computers in healthcare delivery. So that is how technology, in a way, has shifted from the traditional known system. Now, let's look at information science. By the end of this session, students should be able to know the differences between information science, informatics, information systems, computer science, among others. Even though most of them may have some direct relationship with computer science, but they are entirely different disciplines altogether. Information science focuses on the effective collection, storage, retrieval, and use of information and knowledge. It integrates aspects of computer science, cognitive science, social science, communication, library science to manage and utilize information through various technologies and their services. So if you want to look at how these technologies are deployed to manage large data set of information, then it can give credence to appreciating information science. How best we are able to collect patient information, how we store them, how we recover or retrieve them, and how we are able to exchange this information. That is what we mean by information science. So in the examination, you will see a question. Then based on the questions, you have options. And then you are supposed to choose an option that may exemplify or typify a statement. So you may see information science, information systems, informatics, nursing informatics, clinical informatics, all of them be there. So let's take note of that. Within organization, that is a clear picture. So if you go to those in the business environment, they focus more on information systems. So information system is part of what? Computer science. but it is now a standalone, discipline. So the information science was born out of what? Computer science. Computer science is very, very broad. And that is why people may decide to go into areas of specialization. Somebody may decide to become, let's say, software engineer. Somebody may become database administrator. Somebody may also become network administrator, server or network administrator, hardware, among others. They are so vast. And that is the reason why we are now seeing different specialties emerging out of computer science. For instance, artificial intelligence have been well-known part of computer science. But because of the broad nature of artificial intelligence, it has now become a mainstream, standalone discipline. Okay, so that is it. Information science has evolved into a significant field of management, gaining attention in research, and it has also been expanded to accommodate human-computer interactions. And there's an interplay between people, information systems, and organization. So the reality is that we are looking at people who are described as the end users. We are looking at the system itself and how the system may also influence the organization. These are critical factors for technology to be utilized in organizations. Then I said that the information science may also look at an aspect of how human beings interact with computers, especially looking at design features of a computer system and how users are able to interact with different features of the computer and then its applications. So that is what we mean by that. Now, let's look at, but before this, let me pause here, then invite you into the conversation. I remember last week when we met, I was just asking you about your expectations. Yesterday, I was having interaction with a colleague lecturer, and became clear that maybe some of you may have a case. But in terms of delivery, nobody can decide how somebody should lecture or somebody should teach. Somebody can decide to say that I'll give students a chance to ask questions. When I'm done with whatever I'm supposed to teach you, it does happen. We have encountered several lectures where lecturers, invite questions after they are done with their presentation. Others may also put their questions through the chat page so that they can also see and then provide feedback on that. So it is not out of place, all of them, depending on the style or the nature of the style of the lecturer, right? Okay, so I'll pause here, then ask you to, now before that, we are laying a very good foundation for us to have a clear picture of what lies ahead of us. And I want all of you to be actively involved in this kind of conversation or the points I'm going to raise. You see, we have described something in line with information science. We term them as the key umbrella terms in healthcare or nursing informatics. The key umbrella terms in healthcare or nursing informatics. And what are they? We are looking at the capture of information. The capture of information. Then we look at the storage of information. The storage of information. Retrieval of information. Retrieval of information. We look at the sharing or exchange of information. The sharing or exchange of information. Then the last one will be presentation of information. Presentation of information. So in relation to information science, we are going to open up this conversation. And you are going to tell us about the things you do in your facility in line with the points I have raised. So this is how we are going to open up about the conversation. When I ask you about the capture of information, some of you or most of you are using computers in your facilities. Sorry to those who are yet to have a feel of computers in nursing or healthcare delivery. The practical aspect may be missing from your end, but those at the national level, at the tertiary hospitals, the district level, at least they have a feel of how we have really integrated computers as mainstream healthcare delivery. So they are going to recount their experiences in line with what the points I have raised. Then those of you who are the chip zone, you don't also see, because you're not using the computers over there, so you don't also have any experience as far as the conversation is concerned. Before we visiting the hospital one or the other, so we can share our experiences. So over to you. Tell us how patient information are captured onto the computer system. You can even compare the paper-based system with the current system, right? How patient information are captured. Is the question clear to you? Is the question clear to you?
Yes, sir.
Okay, so let's see how it goes. Once you're ready, raise your hand or let me know you're ready to talk, and then so how long you want to take giving me feedback? Okay, now let me go to my friend. Say Amwa. Yeah, let me go to Innocent Amwa, then I'll come to Ali.
Hello, yeah, good afternoon, sir.
Good afternoon.
So usually with where I'm found in my facility, we are using a software system. For instance, we are using our LIMS together with our gyms. So for instance, at the OPD level, if a patient walks in and we do the vital signs checking, there's a portion for us to enter the information into the system. So usually, for instance, we'll pick the patient weight, the height, temperature, and BP. By way of enter into the LIMS system and save it, and it's being captured. That is how usually it's done. Then how the information is being shared with the same use of the LIMS system, the doctor is able to access my information at the nurse's table once it has been entered. Thank you.
Okay. So he has also given us some pertinent information about what really goes into the capture of information. So let me also go to Ali. So my friend, thank you for the feedback. Ali.
Thank you, sir.
Good.
Can you hear me?
Yeah, we cannot hear you.
Okay, thank you. So just as he has said, I think it's no different from what I'm going to say. I think it's a software that is designed so that information collected from patient can be entered, and then from whichever end you find yourself, you should be able to access that information. So once the patient information or data is collected and then entered at the OPD level, every health worker who is having access to that system should be able to access that information from that patient. That's if you have access. So, but the information we collect is no different from what we were doing before the computer system, or let me just say the software was created. It's the same information we still take from the patient, but the difference is that this time around, it is a software. We don't need to carry papers up and down or folders up and down to be able to get the patient information or communicate. So you just sit down at the comfort of your ward or your room, and then you are able to access it. So I think that's the interesting aspect of it. It's very nice. Thank you, sir.
Okay, so Ali has been able to recount to us his experiences that he has been able to juxtapose that with the paper-based system or the folders. It's the same knowledge, but just that there has been transition. So this one is embedded by a software that holds the information. And the other one is that you need to open the folder and then write whatever you want to write. So that is a difference between the two. So that's a very good feedback. Now let me also take it from a different angle. That is, then I'll come to Fatima. That is.
Yes, sir. Sir, please, is what my colleagues have said. We have been also using the links, and it has been designed in such a way that we were all given IDs to open the links. So nobody has access to somebody's ID. We all nurses have been given IDs. So if you are the ward, whatever you do on your patient, you have to chart it. Example like medication, nurses notes. When you feed patients, you will chart. Whatever you do for your patient, you have to chart. And even your changes that the doctors do, you have to enter everything on the limbs. So that's what I also want to see.
That's a very good one. I like the fact that you spoke about some unique identity number of the patient. So that is a trump card for you to get access onto the system. I think that's a very key point. Good. Now let me go to Fatima.
Okay. Please, what I have to say is not different from what my brothers and sisters said earlier.
Okay.
For us, we are using games. We are no more using the limbs, but we still encourage the patients to still keep their limbs numbers with them whenever they are coming around.
You said you are no longer using it.
The limbs, yes, please. But I don't know as to whether in future we will use it again. I can't tell. Because we still encourage the
management. Is it management issue?
That I can't tell.
You were using
I can't tell. For now, it's the games we are using.
You are using games, okay. So
in terms of the
rollout, of the games, what is the impact now? How is it different from the limbs?
That's what I want to talk about.
Okay.
It's okay. And please, the problem we have with the games is whenever a patient comes to the hospital and he's done with everything, he or she is supposed to pay money after the service. When the money is not being paid after 24 hours, it will disappear from the system that that particular patient is owing us. That's the difficulties I have encountered with the games. But for the limbs, it used not to be like that. But I want to also say something small about the limbs. I can't tell as to whether we won't use it again or we will use it in future or something like that. Because sometimes we still encourage our patients to keep their limbs cards with them whenever they are coming. Sometimes the doctors do request for them. So that's what I the letter also have to say.
Okay, so thank you for the insight. Okay, that's a very good one. We are now laying the foundation for more things to come. Catherine.
Sir.
The last person. Okay.
Okay. So I want to talk about the storage of information compared to the paper one or when we were using the folders. I've also experienced that keeping patients' information on the software system, whether the limbs or the games, is much more better because just by plugging in their patient information 5 months ago, 6 months ago, their treatments, the conditions they brought, the progress can be traced back. and then we can have that information to do continuity of care. Whereas previously, you have to go to a room, check the date, sit in there, look for details. Sometimes the information will get missing along the way and all of that. But with the new digitalized system, everything that has been entered can be kept, and the patient can access it in even different hospitals. Yeah, so that's my own.
Now we are appreciating the transition from the paper-based system to the current software that is supporting care providers and then nurses across different healthcare institutions or facilities. And I like the fact that we speak about continuity of care, which may not be the case of a paper-based system, even though in a way it can support continuity of care. But when a patient folder is misplaced, it becomes a challenge. So thank you all for the feedback. Now we are appreciating how patient records or information are captured onto the computer system. You know, when you go to the hospital, the first point of call is the records department. So patients are supposed to do enrollment. Enrollment is what I mean by registration. So it is one of the most important part of having your records captured onto the computer system. So they have to pick your demographic profile and everything, and then issue a unique identity number of the client or the patient. Okay, and that will be a blueprint for you to proceed to other departments to access healthcare services. So that is a very good one. Now it is a way in which patient details or records are captured or are entered or recorded onto the computer system using the unique identity number of the patient, right? So that is the capture of information. Now let's move on to the storage of information. How is patient information stored? We are doing this for the purpose of those people who may not be privileged to have access to digital systems like this. And that is why we need to start from somewhere. Now, let's go to storage of information. How is patient information stored? You all understand, but for the purpose of what you are doing, you need to open up the conversation like that. So, storage of information. I've seen one hand. John.
Yes. Please, I wanted to talk about the challenges of the what do you call it, of the LIMS or the games. Even though there are a lot of positive sides with it, but we have also encountered some negatives. And that is when there is network interruptions. Some of the times you find it very, very difficult to enter or even log into the system. So when it happens like that, if you don't have the patient information at hand, you find it difficult to care for the patient. Unlike the paper-based, that when it is there at every given point in time, you are able to access it, then you use it. So that's what I wanted to talk about with the challenges about the information system.
Okay, so John, I think that's a very good point. That's a very good observation. Dude, I used to have a friend. He was also a rep. He was a rep, last year or two. Dude, okay. Anyway, so he is telling us about the challenges associated with the current software, that is the games. You know, it depends on the setup or the version, the software version. You know, if you want to look at this kind of software, we have some of them that are considered as what point-to-point interface, and others are also considered as what interface engine. So in terms of transition, if one is not working, especially the moment you begin to use that, you face some challenges, right? But with time, as the challenges come and then the remedy that it will become smooth for you. So I think making transition of that sort, sometimes it comes with its own challenges, right? So I don't know whether they saw may resort to point-to-point interface or interface engine. And I noticed that when they introduced some of these software in 2015, some institutions went in for interface point to point. That embraces just some two aspects of what, two features of what the software, and others also go beyond that. So those who started with the point-to-point interface, it was not compatible, so they needed to switch to what interface engine. So I don't know whether maybe that could be the reason, but I'll find out. Anyway, so the storage of information. The storage of information. Please, time is fast spent. You need to make progress. So once I put a question, at least don't delay us, because I want you to be more involved in the conversation, but don't delay us when I put you the question. Storage of information, what is that? Hello. Okay, now let me go to Ali. Oh, the same hands. Okay. Now, Ali, after that, then someone prepare to take us through. Ali.
Thank you, sir. So the storage of information, looking at per what I have observed, when we were using the folder system, patient information were stored at the records level. That's they keep the folders, everything about the patient. Once the patient is done, they will refile or they will file the folders for the next use. But this time, once we are using the electronic, I think the information is stored on the computer. So any moment or anytime the patient comes, the only thing the records will have to do is just to activate the number or the insurance, incorporate the insurance number into the what is that, so that it will be usable. But the information now, I think, is stored in the computer. So anytime the patient just comes, they will just activate the number, and then the patient will start using or having access to the system. So
okay,
that's my observation. Thank you.
Okay, so Lee, thank you for the feedback. Now let me go to Sami, then I'll come to Rakia.
Yes, sir.
Okay.
Yes, sir. So the saving of information or saving of the data, unlike the previous session that with the folders, in case there is a fire, the folders or the information are missing forever. But with the computer system, once your data is collected and input into the system, the information is stored forever, and whatever time we need it, that person or the doctor or the nurse can easily go back, retrieve information for years. But with the folders, some folders get torn. Some patients even end up sending their folders home, which we lose all this information that we kept for the previous visit. But with the computer system, we're able to obtain or save information for years to come. Thank you very much.
Okay, good. So Sami, thank you for the feedback. Okay, he made a point about how to save. Okay. Oh, Rakia-san has dropped. Okay. Simon or Simon.
Yeah, sir, for the saving of the information too, just like my brothers have put it. At first, when we're using folders, you see that clients goes to the OPD or the records room to go and wait for a long period of time for their folder to be removed for them to access healthcare. But using the LIMS or the DIMS, when they go there, their details are being inputted into the computer, then they are able to access all their information and they are able to access healthcare easily. Thank you.
Okay, good, good. Simon, I think that's a very good one. All of them, I think, is what we mean about the storage of information, the things you have said. I mean, let me pick it. Okay, the hands are drop off. Now, in terms of storing information, you have already captured or entered the patient information on the computer, right? But if you don't save what has been entered or recorded, you can't have access to the patient information again. So it is the process whereby patient already entered the information is saved on the computer system. So whatever entries that you make sure that you have saved them for future use or reference. So that's a good one. Now, but you can only do so with the use of what? The unique identity number. What we term in electronic health records as what? Master patient index. Okay. Now let's go to retrieval of information. Now we have saved patient information or we have stored patient information on the computer. When I've been asked to come for review, how do I get access to my history or how do I get access to my previous information? So let's see how it goes. Okay, Simon. Then forgive will come in. Simon, let's take your point.
So it's a question I want to find out based on the storage.
Okay.
In recent time on the social media, there was a hospital that was being sued where a client came to ask for his father's information and then health records. By them, the limbs have gone down. So I don't know, is it that because they couldn't save it, or once the limbs have broken down, I think the facility were not able to be able to identify any health information based on the client, and then the facility was sealed. But I don't know what the reason is.
Okay. For that one, as far as the patient moving from one unit to another, we cannot deny the fact that the patient information was saved because you run from one department to another. So continuity of what care in that way ensured your records are saved. But it could be that there was defective software or breakdown of what the software or any other application. That could be the very reason why they couldn't recover or get back the patient details. If the software is, defective or you have obsolete, things, then you don't expect your system to stay the way it is. It may lead to loss of what? Patient information. So if you also have corrupted files, if you don't have adequate security protocols that ensure that these records are saved, it can also be exposed to vulnerabilities, and that can affect what? Your inability to recover the previous information. I don't know whether I've made myself clear.
Yes, please.
Good. Okay, now let's go to forgive. Forgive all of us, right?
Thank you. So usually at the OPD, when patients come for review, especially those that forget their LIMS card, we ask them the last time they visit the hospital. So when they are able to give us the day or the last time they came, we go into the system to change the calendar to that particular date to retrieve the information and get the LIMS number to them for them to go and register and see doctor. So that's how we retrieve. Well, that's how we can retrieve.
So how do you get access onto the computer system?
Please, you have to log in.
Okay.
With your identity number and then the username. Then when you go to I don't know, filter selection. Yes, that's the links. You go to the filter selection, then you change the calendar there to get the last time the patient came to the hospital, and then get the LIMS number for him or her to go and do the registration.
So are you making reference to first time a patient, or you're talking about somebody who has been there?
Follow up. Who has left his or her card home and needs a card to register and see doctor. Okay.
So I think we get what you are saying. Good. But I was just trying to look at straight away, if I have the computer, I log in with my details, and the patient has come to me. What the patient is supposed to present is the unique identity number, that is the OPD number. That is what will get the patient access or that is what will get the care provider access to the patient and previous history or details. So without the unique number, it will be difficult for you to get access to that. And that is why the number is the core of the electronic health records. And it represents the core of the electronic health record because it is linked to all departments. So without that, even though if you don't have it, I don't know whether maybe there's a way they can generate it for you. But the most important thing is that, just as our sister was also saying, if you also remember the last time you made a visit, once they also trace that, maybe they can, but they still require your number. Okay, good. Now let's make progress to Professor. I want to come off. Okay.
Sir, with regard to that, sometimes too, if the client happen to lose the special identity number, what normally the records people do is that they will ask of your name or your health insurance number, because there are portions that they can input the health insurance number and your name will pop up on their dashboard and they will do another one for you. Aside that too, assuming we are referring a case to, let's say, CODeL from my Volta in Akachi to be specific to CODeL. If CODeL is using LIMS and we are also using LIMS, there's possibly, aside the referral letter that will be added as a hard copy, they can equally enter that special identity number into the LIMS over there and extract the patient information. All that has been done for the client at my facility. Thank you.
Okay, good. Oh, is the professor part of your name or?
Yes, sir.
I hope you don't have problems with GTech, right?
No, I don't have problem with them.
Okay, anyway. Okay, I think you made it very clear that there's a way we can also recover that. Even though in some places, once you also mention your name. But the most important thing is that when you go to the NHIS department, once they activate that, then they are more likely to, get access to your number. Based on your number, they will just write it for you and then you access care. Now let's make progress to. So the retrieval of information is a process whereby patient details on the computer system are recovered using the unique identity number of the patient, right? So the OPD number will get you access to the patient record. Hello.
Hi.
Yeah.
Hi.
I was asking you about the exchange of
So your voice
information,
is very faint.
the sharing of information. I was making a point about the fact that in examination, you will say application-based question, and based on that, you are supposed to select an option that may answer the question. So you need to take note of all the things you are doing. It doesn't mean that the examination is going to ask you about the storage of information, the capture of
We
information.
hardly hear you.
You hardly hear me. Okay. Is it okay now?
No.
It's still not okay.
No, please.
Can't hear.
It's
Let
not
me
okay at all. We can't hear you.
let me adjust myself. Is it okay now?
No,
It's
please.
like your voice is far away.
Far. Are you sure? Anyway, is it okay now?
No.
No, it's not okay.
It's not okay. I think it will get better. So let's adjust. Okay, I have repositioned myself. So it will get better. Is it still not okay?
It's a bit better.
It's okay now.
It's better. It's not okay. It's
Okay,
better.
okay, good. Somebody is told, disputing that is not okay. So Kate, maybe you also have to adjust yourself a bit. Okay. I will see today whether this one is coming from my end. Okay. So I was asking you about the sharing or exchange of information. How does that come about? Especially, look how is information, disseminated or coordinated among care providers. How does information move from one department to another? So let us get your views on that. Is the question clear?
Yes.
Okay, so now let me go to Rakia. Rakia,
Sir,
can
good
I hear
evening.
you?
Yes, please. Sir, for the
too.
links,
Whichever.
Okay,
Rakia
Muntaka.
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 So, sir, for the links, let's take it if a patient is in medical ward and they want to transit out to ICU. The medical ward, the staff in medical ward called ICU gives the information that maybe we have so and so patients to prepare, we are bringing the patient. So they give trial information like that. So we will pop into their system. So from ICU, we can sit in our comfort zone, then go to medical ward, search for the patient's name. So that time they just mentioned maybe Kofi. So we go to medical ward, search for the Kofi, and then go through the information. So maybe if the patient is coming, he needs oxygen, he need like any special care, we'll get to know from the doctor's plan before waiting for the patient to come in. So it's easy as that. And then
Okay.
the side effects, like the side effects of it is now the games they've made in a way that when you are in different ward, you won't get access to a patient's information due to one or two issues like confidentiality, because the limbs, there is a case when one of the staff has STIs and the thing pop up. So you sit in your comfort zone, then search for the patient's name, then you get to see. So that time the information spread throughout the hospital that so have this. So now they've make it in a way that like to some special wards like ICU, the emergency, they all have access to maybe to get to know of what is happening from different wards, and they take notice and take records of each of everything that we does. So we don't go like you are there doing your work, or let me go here and search for someone information and see. You do that when they call you that they are bringing a patient, or maybe you need an information from that patient, like to care for. So that's it. I don't know whether you get.
Okay. Okay, so Rakia, thank you. I think are you done with your submission? Yeah, Rakia. Hello. Rakia. Okay. So let's go to Selassie. Then the next person will be Kate. Selassie,
Yeah. Good evening, sir.
Yeah, good evening.
And to the class. Yeah. Please, for the information storage and the retrieval, all the computers that are there in the hospitals are all linked to a centralized computer called a server. So anytime you needed information, let's say the patient had visited the hospital before and is coming again, all those informations are saved at the server. So you will just be in your ward and you're able to find out all the information that the patients has already have, the previous one, and then the current one, which is like a new attendant, a new patient who is coming to the hospital. Those ones, it's a fresh information you are going to recollect from the records down to the nurses, to the doctors, and all those things. Yeah, so all those things have, all the computers have a centralized system called a server where all those informations are being retrieved from.
Okay. So you got him very well. That's a very good one. The last person will be Kate. Kate, can we hear you?
Okay, so about the information sharing, what I know is every department, the IDs that are created, they have some limitations pertaining to your department and which department that you work with. Let's say the interdepartmentals that are dependent on each other. So let's say female ward, the labs, the OPD, so they can have those areas where female ward can access what OPD routes. And then we can also, there's a peculiar place that the lab will put the results that female ward can still access. And there are other instances where there's a particular place that lab can put information, female ward cannot access, but a doctor can access from their doctor's side, not from the nurse's side. Or let's say a specialized unit like a supply chain, they also use their limbs. But the things that they do with their limbs, we nurses can't access, even though we also have an ID. It is peculiar, so that information can't be shared with us. So it is limited and then open when you want to share it among yourselves.
Okay. So I think that's a very good one. But in simple terms, what I want to say about the sharing of information or the exchange of information, because you have been able to open up a lot about what goes into all the points I have raised. So that is going to be the things to look up for, especially in your examination. It's going to be application-based questions. And I'm sure that is how come some of you are complaining that the things we teach you go to the examination hall and it is not there. At this level, it has to be application-based question. And I must commend you about the active participation in this session. And I am enjoying every bit of your input. So keep it up. Now, in terms of the sharing of information, that is why initially I made a comment that the patient identity number is the unique number that is linked to all departments. And that is the reason why patient can move from what? Let's say consulting room to laboratory to pharmacy in that order. So it is the process whereby patient details already on the computer is shared across the continuum of care delivery using the OPD number. So the most important point here is that, or it is a process whereby patient information on the computer system is sent to another computer system. So there should be different computer systems to receive patient records or information. So without another computer system, there will not be any reception of information. So let's get it very clear. I talk about the fact that the facility has been networked in such a way that it is linked to the patient OPD number. And that is the most important part of electronic health records. So in this kind of exchanges, there should be a different computer system that is receiving the patient information. So the process whereby patient information is sent from one computer system to another through the OPD number. So it allows you to share. It does also apply to, you receiving email from another system as well, right? I hope I've made myself clear to you. Now, the last one to consider is presentation of information. You will see on the computer system, how can we relate to presentation of information? How is patient information presented to you? Or how is patient information presented on the computer system? Does it mean same as retrieval of information? Or are there some relationship or linkages between retrieval of information and presentation of information? Presentation of information. Are you with me?
We are with you, sir.
Okay, so let's make progress. Presentation of information. So I want all of you to learn whatever you are doing here, because we are not talking about the paper-based system. So whatever you do, we are looking at how things have been integrated. We are looking at how we can communicate, how we can retrieve. But the most important thing is the OPD number, which is linked to the system. So if you're defining your channel of information, it should be from one end to another. So if you are referring a patient to another facility, don't forget that there's also another computer system somewhere that is also receiving what you have also sent. So let's look at it from that angle. Then when you get to electronic health records, you will dig deep into most of the things that you have pointed out. So let's go to who is taking us to presentation of information. I'm asking you, is there a relationship between presentation of information and that of retrieval of information? Okay, Sami.
Yes, sir.
Good.
Yeah, so let's say you retrieve the patient's past medical history. When you retrieve, how do you see it? Do you see it? Sometimes you can see like maybe he came and visited, maybe the dates, they are grouping dates. If you're retrieving past medical visits or past medical history, they are grouping dates. So the date he came on a visit, sometimes that's how you see it. So if you want a particular date, you just click on that one. And then you see whatever the patient, whatever information that was taken from the patient, you can see all of them. Some of them, that's how they look like. And then some of them, you can retrieve only the drugs. Hello,
Okay,
sir.
so I want to find out from you, Sami. Once I have the patient number, right? and I enter the number, and the interface opens, or I have access to the patient information. Is that a way information presented?
Yeah, that's how the information is presented.
Good.
That's the presentation of the information.
Okay, then what about retriever? Do they share some similarities, or there could be some minor differences between the two?
Yes. With the retriever, for that one, you are retrieving what was already typed in, or you are bringing back what was already typed in. I think there's a similarity between them.
So if you bring back what has already been captured, or what you already have on the system, does it also deviate from presentation of information, or they have the same path?
I think they have the same path. When you are seeing what was already inputted.
Yes.
So it's the same as the display of information.
Good. So I like the word that
the information and then the display of information is the same thing. So
okay.
you just display
like the word
what you already retrieved. Okay, sir.
Okay. I like the fact that you mentioned the word display. So presentation is just about display of patient information on the system through the entry of what? The patient number. Once you enter the OPD number, it takes you straight to the patient records. Once you can see or you can view what has been captured, it is a way information has been presented to you. And then in the same vein, you can also equate it to, retrieval of information, because you enter the unique number and you also have access to the patient records. So I think that is just a bit about information science, or the key umbrella terms in nursing informatics. Now let's appreciate the following: the types of clinical information systems. Clinical information systems are designed to support healthcare providers in managing patient information and improving clinical workflows. The first one is electronic health records. That is what we define as longitudinal collection of patient and population stored health information in a digital format. Others also put it this way: the digital version of paper-based charts, or the traditional paper-based chart, is what we term as electronic health records. You know, there is a difference between electronic health records and electronic medical records. Initially, when they introduced the software, it didn't include all departments. Most departments were left out. It was just limited to the OPD, the insurance department, records, and billing units. These were the ones connected to electronic medical records. But the more longitudinal one is the expansive nature that brings on board all departments. And that is the difference between the two. Even though, depending on the country of origin, others may also mean electronic medical records as electronic health records, but they are used interchangeably. Centralized digital systems that store patient data, including medical history, diagnosis, treatment, laboratory results, medication information. All these are examples of the types of data stored on electronic health records. So we can term them as minor components of electronic health records. When we go deep into electronic health records, you know the major components, and all these are minor components that are tied to the major ones. Okay. Now we have laboratory information system, which is a major component of electronic health records. They are used to manage laboratory data and processes, including sample tracking, among others. So the laboratory information system is one way or the other part of the electronic health records. Then we also have radiology information system. Radiology, we are looking at X-ray, we are looking at magnetic resonance imaging, computer tomography, among others. All of them are also tied to radiology. It is also part of electronic health records. Okay. Now we also have pharmacy information systems. We are talking about medications associated with pharmacy information systems. Once you talk about pharmacy information system, nursing information systems, we are making reference to computers that are used to support care providers or nurses. So if you want to look at medication management, including drug inventory, prescription, all of them are important. You see, one of the most important part of electronic health records, as we see now, we cannot, underestimate the importance of pharmacy information systems, because pharmacy is the last resort or the last point of call. So whatever goes wrong over there, you know the impact. So most of the conversation about electronic health records may also focus more about pharmacy information systems. The traditional way of, attending to patient or serving patient the medication was that you needed to verify the prescription that comes to the pharmacy or the validity of the prescription, right? Before you can go ahead to, administer the drug to the patient. So it is very important, because if you miss out on anything, then you are going to cause what? The patient. But I remember at first, some of them, especially first year pharmacy students, second year pharmacy students, during their clinical period, they had to move from one facility to another. Then they collect all the prescription forms. They have to verify all the prescription form or look at the handwritings of prescribers on the prescription form. That was how they laid foundation about verification or validity of what? A clear prescription, right? But with the advent of electronic health records, everything is now digital, so things are very easy. Now we also have decision support system. Decision support system, they are meant to support care providers in making decisions. But I will come back and then ask you a question on this one, then we wrap up on this one. Now, patient monitoring system, real-time system used to monitor patient vitals. So this one is just about how we can monitor patient vitals, we can monitor patient progress. Then telemedicine is also going to be a key part of our conversation, but we are going to dig deep into what we mean by telenursing. We are looking at how we can bring to bear information and communication technologies or other web-based systems to support our patients who are in sparsely populated areas, or when there is a distance from one facility to, let's say, a community. We want to see how we can bridge that gap and introduce these modern technologies, so that it doesn't really matter whether you are not at the hospital or you're not seeing your care provider, you can still benefit from more healthcare. That is the point about telemedicine, telenursing. Then surgical and then anesthesia information systems. You are also talking about, systems that are used in operating rooms or theater, emergency department information systems, and population health management systems. All these are the types of clinical information systems that are in use. So they are very important. Let's read around to get them very well. But before that, we have seen point 6, clinical decision support system. It provides real-time alerts, reminders, and evidence-based recommendation. I want to find out from you, your current use of electronic health records. Does the software make provisions of providing care providers alert or reminding systems, or to the extent of even confirming evidence-based or recommendation to ensure that the care provider does not skip off the route, or the care provider is always on the right path or track? Do you have such system in place that ensure that if you are going wayward, the system automatically will alert you, then you make the right changes that will benefit you, the care provider, and your patient? Hello, did you get a question?
No, sir. Sir, it does
No,
not
sir.
alert us.
You said no, sir.
The system does not alert.
Hey, really? Because I remember some of the colleagues I met yesterday, even though because we went for some funeral, one of our lecturers, business department. So I couldn't meet group, I think A. But those I met early in the morning, they were able to confirm glimpses of what decision support tools or elements that is complementing the effort of care providers. So the general consensus on not having some of these things as part of what? The electronic health records. Come clear, because you are not different from your colleagues. Okay, now let me go to Ambrose. Ambrose.
Yes, sir. So good evening.
Good evening.
I don't know if you can hear me clearly. But what I know is that the system actually supports those changes. With the OPD, when you are consulting, and at the end of it, or you do not bring your diagnosis, the system will not allow you to save it. You have to go in and save your notes. And the second is when you choose a drug, and if you don't include the unit of the drug, it will not allow you to save. If you don't include the dosage of the drug, it will not allow you to save unless you go back and make those corrections before you can save it. That's what I know about the system. Thank you.
Okay, I think he has also raised a very important thing that when, let's say, you have made one input and you don't rectify it, the system will not permit you to make progress. I think it is one feature of a decision support system. So that is why I said that whether you are seeing signs or glimpses of what decision support, it is a software itself that is embedded or integrated into the electronic health records to complement care providers so that when they are going off track, the system will just bring them to the right path. Okay, so I saw one more hand. Forgive. Okay, so let's hear from Forgive. Then Professor will wrap up, and then we see whether we can end proceedings. Forgive, what do you have for us? Okay, if Forgive is not ready, let me go to Professor. Prof.
Professor.
Yeah, Prof.
Please, all right. All right, my brother has established the point already, but at the OPD at the same time, when you enter, let's say, a temperature that is higher than the normal, sometimes the pop-up will come for you to intervene before you can save or you do otherwise. The same thing applies to the BP too. But aside that too, there are some clients who they have some allergies. So once they come in first and we're able to detect or to know their allergies, and you have actually entered it as a data concerning that client, anytime you are to attend to that client, the pop-up will come that this client is allergic to so and so drugs or so and so condition. Thank you.
Good. I think they have been able to establish attributes of what decision support system. But let me take it from this angle. She raised a valid point about, allergic reactions. Some patients may be reactive to certain medications. So it is very important that the clinician will have to indicate it as part of the patient records, so that whoever is new to the patient will be able to see that once you prescribe this drug to the patient, because of that condition, you can't do that. So at the moment, for instance, there are some patients who may be allergic to sulfur products, and certain medication contains sulfur. For instance, you can talk about Septrin. Septrin contains sulfur. So on the basis of that, if somebody is, let's say, this ADP, client or patient, it has to be indicated on the system. So if you go off track or it is not noticeable, or you don't take notice of that out of oversight, the system will have to alert you that this patient is reactive to the prescribed medication. And then you also made a point about vitals. Okay, you check and then you're having abnormal ranges. The system will have to just alert you for you to intervene. So these are some glimpses of decision support system. So as part of, it's not a cool, but just go and then ponder on some of the things that we can also add up to the features of decision support system. We are going to treat that as a major topic, but I want you to also look at other areas to see decision support system complementing care providers' effort. Okay, I think we have 3 minutes to go. I need to pause here before they take me off. The reason why I'm going slowly is that I want us to have a very firm foundation for understanding what lies ahead of us. So we need to take it gradually. But next week, we are going to go, very fast because you have a lot of things to do. Is there anything I have to know before we end our proceedings? Is there any question? But I'm going to give you this. I'll share the slide so that you can familiarize yourself before our next meeting, right? So let's do that. Is there anything I have to know? Okay, in the absence of questions or any contribution from someone, I suggest we draw curtains on today's meeting. Thank you all for making it to this meeting. It is my view, it is my hope that we are going to enjoy the informatics to the fullest. And I always take delight in meeting nurses, especially because I see that quite a number of you really want to always contribute. And I appreciate that. Let's continue to keep it up. I saw one hand. Is there anything? Okay. So thank you all for coming. Enjoy your weekend and the rest of your meetings. Bye-bye. Okay, one point here. Prince, yeah, boy. Let's take it from you.
Hello, sir.
Yeah, Prince.
Yeah, please, can you go over the electronic health records information system?
I don't know whether maybe if time will permit us. Electronic health records. I was just making a point about the fact that that is what we are using in our facilities now. So depending on your department, you input your information that is going to guide you. And that is why we have nursing information systems. When you talk about nursing information system, we are talking about computers in nursing or in healthcare delivery. So whatever resources that you have, it is stored onto the computer system because the computer system, electronic health records, is a software. And we define the types of what? Data or data elements that are stored on electronic health records. So I made mention of what? Medical history. I also talk about medication, laboratory or test results, vitals. All of them are integral part of what? Electronic health records. Okay. But we are going to go deep when you get to electronic health records and you understand it better. You get it? It is just a software, right?
Okay, sir.
Okay. So enjoy your weekend and then make sure you have a very good week, right? All the best. Bye-bye.